Cu o tradiție medicală de 150 de ani, o clinică privată din Austria este unul dintre cele mai solicitate spitale din Europa. Anual, specialiștii tratează aici peste 12.000 de cazuri, inclusiv din România, printr-o abordare multidisciplinară. Pacienții au parte de un diagnostic de precizie, tratamente țintite și un departament special de prevenție și depistare timpurie a cancerului.
Ce reprezintă Centrul Comprehensive Cancer Care Vienna?
Comprehensive Cancer Care Vienna represents a network of top specialists and leading institutes involved in the care of cancer patients at a high academic level. We combine the expertise of our top specialists to provide patients with a clear diagnosis and an individualized approach to their disease. It is a great advantage that our specialists are usually involved in research, in leading research and clinical trials. Thereby, important actual results can be incorporated in the management of cancer patients.
De ce aleg pacienții Austria pentru tratamentele medicale?
In Austria, we have a long tradition of optimal care for cancer patients. This is reflected in a very good survival statistics, and Austria ranks among the top 5 countries internationally with the longest survival rates for cancer patients. The reason for this is multifold. Predominantly, we have a good infrastructure of our hospitals, but also, and most important, we have rapid access to new techniques and new medications.
Care este misiunea Centrului Oncologic?
Our mission is to provide patients with a cancer diagnosis with rapid access to top specialists who then provide clarity for the patient about their diagnosis and provide access to the most suitable treatment for the individual disease.
Care sunt principalele progrese în domeniul oncologic?
Traditionally, cancer treatment was based on surgery, chemotherapy, and radiotherapy. These important basic approaches to the treatment are still valid, but we have learned a lot about the disease, and in particular advances in our understanding of the biology of the disease and also the genetic factors underlying a cancer disease has provided new access to treatment. This is reflected by new approaches including immunotherapy, but also more targeted treatment approaches. This is based on the fact that each disease is characterized by very specific features, and we try to understand these and then develop very directed treatment approaches with the aim of maximizing the effect on the cancer cells, but not attacking the healthy tissue and the healthy cells.
Cancerul în familie este cancerul moștenit?
There are a few cases of familiar cancer. This is, for example, well known in the context of breast cancer. So a very famous actress in America has made her story very public. But these cases of inherited cancer, they represent only a minority of cases. Many cases of cancer diseases are what we call sporadic cancer. This is a combination of genetic predisposition plus the effect of external factors like unhealthy lifestyle, smoking, abnormal amounts of alcohol, and the like.
Putem evita complet factorii de risc pentru cancer?
There is a great debate what is the influence of genetics and what is the lifestyle. But let's assume that it's about 50% genetic, 50% of lifestyle. So you have a huge amount that can be influenced by healthy living, by physical activity, by healthy eating, and so on. And then there is an important other factor. Use regular checkups so that you are able to detect, in case of cancer, the disease at a very early stage. This is also an important contribution for prognosis and the development of the disease, because early disease can be treated very well and then the prognosis usually is excellent.
Ce este deosebit de important la testele de screening pentru cancer?
Screening is primarily aimed at the early detection of a cancer diagnosis if the disease really evolves. And this is particularly true for the main entities like breast cancer, colon cancer, lung cancer, and also prostate cancer. Appropriate imaging techniques are important to look for early signs of cancer. Therefore, tests like mammography or colonoscopy and the like, they are really indicated for early detection.
De ce avem nevoie de o echipă de specialiști pentru un tratament de succes?
For the treatment of cancer, it is very important that a team of experts collaborate for an individualized treatment plan. Usually, we need to coordinate medical treatment like chemotherapy or new medications and surgery and potentially radiotherapy. But the sequencing is very important. Therefore, meeting of experts, looking at the findings, and then developing a treatment plan is essential for successful treatment.
Care sunt avantajele noilor terapii medicamentoase?
A very important novel development in cancer treatment is a specific immunotherapy approach. This is based on the knowledge that cancer cells are able to protect themselves for detection by the immune system. At least some molecules have been defined how this is possible, that the tumor cells evade from the surveillance of the immune system. And now we can use very specific antibodies to block these molecules on the cancer cells, and thereby the cancer cell gets detected by the immune system, and again the immune system is able to attack the cancer cell.
De ce ar trebui un pacient diagnosticat cu cancer să obțină o a doua opinie oncologică?
This is very important because at some centers you may get access to modern treatment approaches. You may get a re-evaluation of your tissue sample and thereby get additional information about the subset of your diagnosis. And then this all together has a great impact for your individualized treatment plan.
Cum va arăta tratamentul cancerului în viitor?
We will not treat with chemotherapy in the future. We will treat with targeted treatment, very specific medications, immunotherapy approaches, and this combined with minimally invasive surgery.
Ce înseamnă comprehensive care, deci o îngrijire cuprinzătoare pentru cancer?
When we think about cancer treatment, it is not just important to look at the technique and the medications themselves, but also at the entire treatment plan. What we mean in this context is a comprehensive approach with all co-medication necessary to make treatment very tolerable, but also to look at recommendations for nutrition, for physical activity, for psychological support. So in other words, really to see the patient, the person as a whole, and considering all these aspects for an important care of the patient.
Vom reuși să învingem complet cancerul?
We have seen many positive developments in the past years. We have learned about the disease, we have improved our capabilities of treating the patients, we have improved survival rates. However, it will not be possible to eradicate the disease in all patients. But what we have achieved is to use the modern approaches and the medications to make cancer a chronic disease. What we mean is that, like with hypertension, like with diabetes, you need some medication to control the disease, although it cannot be cured. But you live with the disease, you have a good quality of life, and thereby you can live your life with your daily activities, with your professional life, with your leisure time. And when we get at this point, this is already a major advantage and success. And we will build on this for the future and develop our care for cancer patients even further.